This is a sagittal section through the upper part of the head and the neck. If we begin with the nasal cavity, we know that the nasal cavity is lined by mucous membrane, except for the most anterior and inferior part, which is the vestibule. This is covered by skin. In the lateral wall of the nasal cavity, there are three projections of bone which are quite visible. These are the three conchae, superior, middle, and inferior. And below each concha there is a meatus with the name of the concha. So we have superior, middle, and inferior meatus. If we look at the sinuses of the head, this is the frontal sinus. This is the sphenoid sinus. Then we have two other sinuses not visible here. The sphenoid sinus opens into the sphenoethmoidal recess, which is located beyond and above the superior concha. Below the superior concha, in the superior meatus, we have the opening of the posterior ethmoid air cells. So you can say that if there is a pointer to this area, what is this area and what duct opens into it, you can say this is the superior meatus and the posterior ethmoid air cells open here. In the middle meatus, this is the semilunar hiatus, or the hiatus semilunaris. On the most anterior part opens the frontal sinus through the frontonasal duct. It goes posteriorly. On the posterior part there is the opening of the maxillary sinus of the semilunar hiatus. And of course this anterior part is called the infundibulum. So if there is a pointer here, you say the infundibulum part of the semilunar hiatus, and what structure opens into it? The frontal sinus opens into it. In the most upper part of it, this is variable of course, but usually in the upper part of the middle meatus there is the opening of the middle and anterior ethmoid air cells. So the posterior ethmoid air cells in the superior meatus, the middle and the anterior in the middle meatus. In the anterior part of the semilunar hiatus there is the frontal, and in the back there is the sphenoid. In the inferior meatus there is only the opening for the nasolacrimal duct. So we know that the nasolacrimal duct passes posteriorly downward and inferiorly, downward and laterally, to open into the inferior meatus of the nose. Of course, we can see the specialized area of the mucous membrane. This is the olfactory mucosa. The olfactory nerve cells emerge here. They pass up through the cribriform plate to form the olfactory bulb. Then at the back of the nasal cavity, there is the salpinopharyngeal fold. It arises from where? From the surrounding of the opening of the auditory tube. So this region, this is the auditory tube. The elevation around it is the tubal elevation, or the torus tubarius. And there is, you can say this is the tubal sinus, the tubal tonsil. The tubal tonsil. There is a tonsil as well related to this area. I think it's visible in the other sample. Yes, this one. This is the tubal tonsil. And here, this space, this is the retropharyngeal recess. Behind the salpinopharyngeal fold. And then we go to the oral cavity. We can see two of the intrinsic muscles of the tongue. These are the longitudinal muscles and the vertical muscles. The transverse go like this, so they're in a different plane. And the extrinsic muscles, we know that the lowermost muscle is not a muscle of the tongue. This is the mylohyoid. Above it again is not a muscle of the tongue, the geniohyoid, from the mandible, from the inferior mental spine to the hyoid bone. And above it is a muscle of the tongue, genioglossus, from the superior mental spine at the back of the body of the mandible to the tongue. These are the fibers of the genioglossus. This is the lingual tonsil, the collection of the lymph nodes, or the lymphoids. And at the back, behind the lingual tonsil, this is the valleculae. This is the epiglottis, this is the lingual tonsil. This space is called valleculae. And the most median fold is the glossoepiglottic fold. So this ridge, this is the median glossoepiglottic fold. And the space itself is called valleculae. At the back of the tongue, here it's not visible. There are supposed to be two folds, a fold going to the pharynx and a fold going to the tongue. I believe it's visible in the other model, the palatopharyngeal and the palatoglossal folds containing the corresponding muscles, and between them, this is the palatine tonsil. Okay? Masha. And then we come back, of course we know the regions of the pharynx, the nasal, the oral, and the laryngopharynx, or the hypopharynx. From the epiglottis we go down, we see the vestibular fold. Okay. Below it there is the vocal fold. Between them there is the glottis, or you can probably, it has many names, yes, rhinoglottis or glottis, or sinus of the larynx. It's also called the middle region of the larynx. Just say glottis. This is the vocalis muscle, which is part of the thyroarytenoid muscle, and this is the transverse arytenoid. Any other features? The ligaments they don't have creative names. From the structures they arise to the structures they go. So this comes from the hyoid to the epiglottis, so it's hyoid epiglottic ligament or membrane. From the hyoid bone to the thyroid cartilage, so thyrohyoid membrane and ligament. From the epiglottis to the thyroid, the same way. From thyroid to cricoid, from cricoid to trachea. They're according to the location, the origin and the insertion of the ligaments.
早的时候就